Friends, welcome to this newer edition of Knowledge Capsule on obesity and bariatric surgery. Friends, what is obesity? Obesity means when the content of fat in the body increases beyond the normal level, it is called as obesity. यानी जब शरीर में मोटापा यानी फैट एक लेवल से ज़्यादा बढ़ जाए तो उसे ओबेसिटी कहते हैं. तो मॉर्बिड ओबेसिटी क्या होता है? What is morbid obesity? Morbid obesity means when the level of fat content in the body increases to that level that it starts creating problems, diseases in the life of a person, it is called as morbid obesity. Once the person becomes morbidly obese, then not only will it affect his life, span of life, but also the quality of life. दोस्तों, मोटापे में हमारे पास बहुत सारे स्टेजेस में पेशेंट्स आते हैं और हर पेशेंट जो हमारे पास आता है उसकी सेम ट्रीटमेंट नहीं होती है. We have to consider obesity as a disease. Like any other disease, even obesity is a disease and it has to be treated as per stages or grades of obesity. If a person comes to us in a normal weight category where they just want to maintain their weight, the treatment might be just diet. When the person comes in overweight category, that is a BMI less than 30, we might just advise them diet and something extra like exercise, a gym, a yoga or something else. But once a person comes to us in grades of obesity where the BMI, that is body mass index, is more than 30, then friends, the option becomes only one, and that is bariatric surgery. Friends, it is a very, very important information that I want to pass on, that bariatric surgery today is one of the safest options for a patient who's got morbid obesity or severe obesity. Whenever we try to decide what is the type of treatment that the patient is need to be given, we directly don't tell the patient that you have to go for this treatment or that treatment. We decide on the basis of BMI, we decide on the basis of what medical problems he or she requires. So if a patient is morbidly obese and the patient has got no other medical problem, we might go for a basic procedure. When the patient has got associated diabetes, hypertension, very high BMI, we might go for a different procedure. So all these procedures which we do, whether it be a sleeve gastrectomy or a mini gastric bypass or a gastric bypass, all these procedures are done laparoscopically. What is laparoscopy? Laparoscopy means keyhole surgery. So when a patient comes to us, we tell them that we make the entire surgery with the help of 4 or 5 small holes from which my laparoscopic trocars will go into the abdomen, and along with that, my telescope will go in. Telescope gets attached to camera, camera attached to TV. I look into the TV and operate. When my telescope goes inside, the smallest of thing looks 10 times magnified. So the precision of surgery is very high. And results of surgery, friends, are such that the person is operated in the morning and the same evening you find the patient walking around. Within a day or two, you will find the patient doing all the type of work that he was doing before surgery, he is able to do after surgery. Friends, bariatric surgery decision is a major decision which the person has to take. Today, if you are overweight, if you are obese, grade 1, grade 2 or grade 3, you should consult a specialist. What is the ideal type of treatment? You cannot have one treatment for everyone. So a grade 3 or grade 2 patient of obesity cannot say that I'll just be okay by taking diet, because diet has got its own limitations. I would also like to tell you all one thing very clearly, that this surgery is now safe right from a boy by a girl who's 9-year-old to a man or a woman who's 70 to 73 years old. We have been operating such patients regularly. And we don't operate the patient till the time we have done the patient's entire investigations, gone through all pre-surgery protocols to ensure that the patient should have a risk-free surgery. And suppose the patient has got some medical problems and we know that with heavy weight and these problems he is having mild risks for surgery. Still, we also evaluate whether the risk in surgery is more or the risk in not getting operated is more. And if we find that the risk in getting operated is lesser, it is always worthwhile to do the surgery with lesser risk and get the patient a better quality of life. Friends, bariatric surgery is one surgery which can change the life of a person, which can ensure that there is complete transformation of a person. It can also ensure that the person lives more, lives happily, lives healthily. Friends, if you have liked this video, please share it to your friends and relatives. Spread our campaign of Gift a Life, because by bariatric surgery, a person who is obese or morbidly obese, who is leading a very poor quality of life and a very unstable life, might definitely get a new life. So spread this, share this on Facebook, on Twitter, and also spread this amongst your friends and relatives whom you feel are ideal candidates who will have an improved quality of life after undergoing bariatric surgery.